So we are Group 2, also known as Team Momo Medical, and my group members are Guus, David, Ignacio, and myself, which is Danny. So Momo Medical is a Delft-based startup focused on preventing pressure ulcers, and it's founded by Ide Zwager and Menno Gravenmaker. So the product they developed is called the BedSense, and this device uses an electronic sensor to monitor patient movements. This could potentially help specialists to avoid under and over treatment, meaning that the efficiency of nurses is increased together with patient comfort. So we use the opportunity analysis canvas as a tool to effectively identify and analyze entrepreneurial opportunities and ideas. So thinking entrepreneurially is that both founders had entrepreneurial motivation, resulting in the entrepreneurial behavior in the form of the creation of Momo Medical. Seeing entrepreneurial relates to the combination of the increasing life expectancy and the cutback on healthcare budget, which resulted in two macroeconomic changes, which Momo Medical could capitalize upon. And acting entrepreneurially, thinking and seeing combined led to the identification of a clear market opportunity for Momo Medical, and pursuing this opportunity by reducing the workload with digital capabilities while improving human well-being. So nurses need to optimize the workflows and efficiency to keep up with the patient demands, and this means minimizing redundant checks and actually caring for patients who need it. So the value proposition of the BedSense consists of two elements. First, they lower the workload for nurses, but they also potentially save a fraction of the 15 billion that is annually spent on the treatment of pressure ulcers in the European Union. So these are the 5 different growth stages that Momo passed through throughout its lifetime. Currently, Momo is in the final stage as they are striving to penetrate new markets, scaling up their businesses, and also raise more capital. Nevertheless, their 250,000 annual rate of return already indicates a form of sustainable returns. Some example of the critical junctures they passed throughout their, or they actually had to overcome were patent application, customer relations, and obtaining funding. The business model canvas is defined into 3 main elements, excluding the already mentioned value proposition. So the value creation, Momo Medical is already using established networks to reach elderly homes by using strategic investors, which are not only investing capital funds, but also have relationships with nursing homes. So value capture, Momo Medical is charging customers a fixed amount per month for using their app, which is a subscription model, in combination with a one-time payment for the hardware of the BedSense. Considering the cost structure of Momo Medical, it is assumed that they need to pay manufacturing costs, man-hours, cost of servers, and maintenance of the hardware. And finally, value delivery. Momo Medical is using a bottom-up approach as they try to enter elderly homes throughout the nurses instead of the managers. This is because nurses will detect the potential of the BedSense and ask their organizations to acquire them. So if we go to the business model of Momo Medical, the business model was adjusted multiple times throughout the past 5 years of operation. As can be seen, 3 different time frames are defined to visualize the business model dynamics. The dynamics in these time frames relate to 2 different perspectives. One is on market development and the other one on product development. In this case, initial key partners suggested improvements to the BedSense as they could benefit from additional features such as fall detection and optimizing morning routines. The methodology of Kodai and Oort was used to assess the business model dynamics. Important to note here is that a lot of specific information to assess company and network dynamics was not publicly available, meaning that the information was often assumed and not specified. And throughout the years, Momo Medical discovered that the problem they had observed was more challenging in nursing homes instead of hospitals, and therefore they decided to adjust the business model and completely focus on elderly care instead of hospitals. So as mentioned on the last slide, the focus on elderly homes instead of hospitals resulted in the following beachhead market. So the TAM equals the elderly homes in the Netherlands, the SAM equals the elderly homes in the Randstad, and the SOM equals the elderly homes in Delft. So the technology pattern, As we speak, Momo Medical is in the adaptation phase due to the fact that they are testing their product in 2 markets, the Netherlands and the USA, and they are actively receiving feedback from customers. And as can be seen, several milestones were achieved to enter the adaptation phase, and this transition is marked by the commercial launch of the bed sense back in 2019. As the adaptation phase, Momo Medical faces direct and indirect competition, including technical and non-technical solutions that try to create value for elderly homes. However, their bed sense is more patient and user-friendly compared to the competition. As Momo Medical aim to enter large-scale diffusion, different niche strategies can be described on the next slide to overcome the barriers. So Momo Medical adapted 3 different niche strategies. The first one is lead user strategy, as the company works with elderly homes that are willing to use the product. The second strategy used is educated niche, as Momo Medical aim to increase the knowledge of how to use their product. And the third one is the geographical niche, because the firm started to use their product with residences nearby Delft and recently started to expand to the USA. So we recommend Momo Medical to further strengthen its educated niche strategy, for example, with videos showing the user experience and other product benefits, and thereby the increasing brand and product awareness. Furthermore, the current pandemic offers an opportunity to further test their product with long-laying patients. And as a result of these recommendations, the company can start to develop new niches in parallel, which aid Momo Medical to reach large-scale diffusion quicker. So thank you for listening, and if there's any questions, all of our group members are happy to answer those.